Understanding necrotizing myopathy, a threat to muscles. This rare and debilitating condition is gaining attention in the medical community. Necrotizing myopathy is a rare muscle disease that affects a small percentage of the population. It causes muscle weakness and damage, leading to significant physical limitations. The term necrotizing refers to the death of muscle cells, which is a hallmark of this condition. This occurs due to inflammation and lack of blood flow, which further exacerbates the muscle damage. This disease is a serious condition that requires immediate medical attention. It can significantly impact a person's life, making even simple tasks challenging. Patients often experience difficulty with everyday activities. These activities include walking, climbing stairs, and even breathing, which can be severely affected. Necrotizing myopathy has different forms, each presenting unique challenges. Each form has unique characteristics and causes, making diagnosis and treatment complex. However, all forms share the common feature of muscle fiber death, which is central to the disease. This results in progressive muscle weakness, affecting the patient's quality of life. Understanding the different types and causes of necrotizing myopathy is crucial for effective management. This knowledge helps doctors diagnose the disease accurately and tailor treatments to individual needs. It also guides them in developing effective treatment plans, offering hope for better outcomes in the future. A look back. Unraveling the mystery of necrotizing myopathy. The journey to understand necrotizing myopathy began in the mid-20th century, a time when medical science was rapidly evolving. Early reports described cases of unexplained muscle weakness, which puzzled doctors and researchers alike. These cases involved muscle inflammation and damage, often severe and debilitating for the patients. Over time, doctors and researchers observed similarities in these cases, noting common patterns and symptoms. They recognized a distinct pattern of muscle damage, which was unlike any other known condition at the time. This led to the classification of necrotizing myopathy as a separate disease entity, marking a significant milestone in medical research. Initially, the cause of necrotizing myopathy remained elusive, leaving many questions unanswered. However, further research revealed important insights, shedding light on the underlying mechanisms of the disease. Scientists discovered that the immune system plays a crucial role in the disease, attacking the muscle tissue. In the late 20th and early 21st centuries, significant progress was made thanks to advancements in technology and research methods. Researchers identified specific antibodies associated with necrotizing myopathy, which provided a clearer understanding of the disease. This discovery revolutionized the understanding of the disease, paving the way for new treatments and better patient outcomes. The immune system's role, autoimmunity, and drug-induced myopathy. Understanding these conditions is crucial for effective treatment and management. Autoimmune reactions are a key player in many cases of necrotizing myopathy, a severe muscle disease. In these cases, the immune system mistakenly attacks the body's own muscle cells, leading to significant health issues. Antibodies, which are proteins that normally target foreign invaders, start targeting muscle fibers, causing harm. This attack leads to inflammation, damage, and eventually, muscle cell death, severely affecting muscle function. Another important trigger for necrotizing myopathy is medication use, which can be a hidden danger. Certain drugs, while generally safe, can cause an adverse reaction in some individuals, leading to serious complications. This reaction can lead to drug-induced necrotizing myopathy, a condition that requires immediate medical attention. Statins, medications used to lower cholesterol, are one example of drugs that can cause this condition. While effective for many, they can trigger an immune response in some, leading to muscle issues. This response can result in muscle inflammation and damage, highlighting the need for careful monitoring and management. Recognizing the enemy symptoms and diagnosis of necrotizing myopathy. Early recognition of necrotizing myopathy is vital for effective treatment. The disease typically presents with muscle weakness, often starting in the hips and shoulders. Patients may experience difficulty with everyday tasks. These include climbing stairs, getting up from a chair, and carrying objects. Muscle pain and fatigue are also common symptoms. Diagnosing necrotizing myopathy involves a combination of methods. Doctors will conduct a physical exam and review the patient's medical history. Blood tests are crucial to look for specific antibodies associated with the disease. Muscle biopsy, a procedure to examine muscle tissue under a microscope, is often necessary to confirm the diagnosis. Section 5. Battling back. Current treatments for necrotizing myopathy. Treatment for necrotizing myopathy focuses on suppressing the immune system and managing symptoms. Immunosuppressive drugs, such as corticosteroids, are often the first line of therapy. These medications work by reducing the immune system's attack on muscle cells. In cases of drug-induced myopathy, stopping the offending medication is crucial. Intravenous immunoglobulin, or IVIG, therapy is another treatment option. IVIG provides the body with healthy antibodies. This can help modulate the immune response and reduce muscle damage. Physical therapy plays a vital role in managing the symptoms of necrotizing myopathy. It helps maintain muscle strength, flexibility, and range of motion. Section 6. New Horizons. Research and future directions in necrotizing myopathy. The future of necrotizing myopathy treatment holds promise. Researchers are actively investigating new therapies to target the disease more effectively. Clinical trials are underway to evaluate the efficacy of new immunosuppressive drugs. These drugs aim to provide better control of the immune response with fewer side effects. Gene therapy is another avenue of exploration. This cutting-edge approach aims to correct the genetic defects that may contribute to some forms of necrotizing myopathy. Stem cell therapy holds potential for regenerating damaged muscle tissue. Researchers are investigating ways to use stem cells to repair and replace affected muscle fibers. Section 7. The importance of early detection and intervention. Early detection and intervention are paramount in managing necrotizing myopathy. Prompt diagnosis and treatment can help slow disease progression and preserve muscle function. Patients experiencing unexplained muscle weakness or pain should seek medical attention. Early consultation with a doctor can lead to timely diagnosis and intervention. Increased awareness of necrotizing myopathy is crucial. Educating healthcare professionals and the public about the disease can aid in early recognition and referral. Timely treatment can make a significant difference in the lives of individuals with necrotizing myopathy. It can help them maintain their independence and quality of life. Section 8. Living with necrotizing myopathy. Support and resources. Living with a rare disease like necrotizing myopathy can be challenging. Patients and their families need support to cope with the physical and emotional aspects of the disease. Support groups and online communities provide a platform for patients and caregivers to connect. Sharing experiences and knowledge can empower individuals and foster a sense of community. Physical therapy, occupational therapy, and counseling can help patients manage the challenges of daily living. These resources provide practical strategies and emotional support. It's important to remember that patients are not alone in their journey with necrotizing myopathy. Support and resources are available to help them navigate the challenges and live fulfilling lives. Section 9. Conclusion. A hopeful future for necrotizing myopathy patients. Necrotizing myopathy, while a serious and potentially debilitating disease, is no longer an insurmountable challenge. Significant progress has been made in understanding, diagnosing, and treating this complex condition. With ongoing research and the development of novel therapies, the future holds promise for individuals with necrotizing myopathy. New treatments offer hope for better disease control, improved quality of life, and a brighter future. As we continue to unravel the complexities of this disease, we move closer to a future where necrotizing myopathy is no longer a threat to muscle health and well-being.